Good morning, everyone. I'm Olivier Coupry. I work for the Fondation Médéric Alzheimer as Field Innovation Manager, and I am delighted to share with you the first result of our experiment on the night. Most people want to live and stay at home, but for some people with dementia, we also know that the end of day and the night are sensitive moments, with loss of temporal landmarks, and anxiety, confusional syndrome, sleep disorders, which often cause sleeping trouble, waking up, or wandering. Family caregivers are often impacted by the difficulties of their relative with problem of health, stress, reduction of social life. And finally, these nighttime problems limit the possibility of living at home and are one of the main causes of entering a nursing home. In addition, in France, the intervention of social or healthcare professional at night is still an underdeveloped solution. For all these reasons, we have launched a call for project to support innovative action on this subject. The Fondation Médéric Alzheimer has selected 4 projects that we currently support. These projects are innovative because they provide answers to needs that are not covered or insufficiently covered. 2 projects are home-based support. They deal with home intervention carried out by a professional in the evening or during the night. Sessions are organized in cycle. One of the 2 projects implement multi-sensory relaxation session with massage, soft music, olfactory atmosphere to improve sleepiness and the night progress. The other project makes it possible to carry out a diagnosis of the situation and provide an action plan. In both projects, family caregivers receive practical advice to help them to cope with the difficulties or avoid them. The 2 other projects offer overnight accommodation in a daycare center or in a nursing home. 1 or 2 people are hosted per night, depending on the project, in adapted, comfortable, and warm places. The hosted person can benefit from adapted activities defined according to his or her desires and needs, and an evening snack and an a la carte breakfast are offered based on the taste and habits of the guests. In order to draw lessons from this project and to identify their effects, the Fondation Médéric Alzheimer has decided to carry out an assessment. This assessment is developed with the care professional in a collaborative approach. Data collection is based on various tools like observation grids, questionnaires, or interviews. Currently, 40 people have used one of these services for a total number of 169 nights. This experiment is running from mid-2019 to March 2021. Due to the COVID crisis, the project has been put on standby. The recovery is quite difficult and uncertain. This point explains why the data are still being collected and analyzed. But I can share with you some of the first effects observed. Of course, this result will have to be confirmed by the analysis of all the data. For people with dementia, we can highlight good acceptance of the proposed intervention, a gradual rebalancing of sleep rhythm, enhancement effect through participation in the proposed activities. For family caregivers, we can highlight respite and relief, acquisition of skill and strategy provided by professionals, and greater acceptance of health. For the BL, we can mention peaceful relationships between people with dementia and their family caregivers and more shared activities. To conclude, let's hear family caregivers. Their spouse benefit from the overnight accommodation in a nursing home. She says, "I'm really very happy with this opportunity that has been offered to me. My husband regularly wakes up at night. I couldn't imagine continuing to spend a whole night without sleeping. It's a huge relief. I'm alive again. Now I get to sleep 2 nights a week, which is already a lot for me. Thank you for your attention. If you wish to continue the discussion, please send me an email. Bye-bye.